Thank you. Good evening, everyone. My name is Dr. Karishma Sharma. I'm a consultant physician currently working at Avenue Hospital in Parklands. It's an absolute honor and privilege to discuss this topic that is very dear to me, considering we see a lot of these cases in the hospital. And I would like to applaud the Parklands Baptist Church for such a great initiative trying to spread awareness regarding all these conditions that we are seeing in the hospital. So I look forward to presenting to you all, and I look forward to the interactive session that will follow after this. I'm going to start with a few questions, and I'd like us to engage a bit before I discuss the topic. So could someone tell me what do you think, is this a true or a false statement? Do strokes only happen to elderly people? Anyone from the audience can just answer that. I don't need to know what you look like. And this is a learning session. False? Okay.
Yes, false.
False, okay, great. Strokes can't be treated. True or false?
False.
False. Anyone think this is a true statement? Okay, we'll look to see whether it's true or not. Strokes are not preventable. Is this true or false?
False.
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 Okay. Anyone think this is a true statement? Strokes happen in the heart.
Yeah, true.
True. Okay.
False.
Anyone?
False.
False. True,
False.
false. Okay. Well, we'll find out soon. And the most common symptom of stroke is pain.
False.
False. Anyone think this is true?
True.
True?
Yep.
Yeah. So I'm hearing a few trues. I'm hearing a few false. So I think let me get through with the presentation, and then we'll come back to this and see how much of it is true and how much of it is false. Okay? So strokes are rare. Are strokes rare?
False.
False?
Oh,
Anyone think this is true? Strokes are rare? I don't mean the strokes during golf. I mean the strokes. Yeah, strokes are rare. Anyone think this is true?
oh.
Wow. Okay. Yeah. So we'll look to see which of these are false and which of these are true. So what is a stroke? So this stroke is a term used when a part of the brain dies because it goes without blood for too long. So let's remember that a stroke takes place in the brain and not in the heart. When the same thing happens in the heart, it's called a heart attack, okay? And there are two types of strokes. There's an ischemic and a hemorrhagic, and we'll discuss further about it. Now, what I want us to take away from this picture is this picture is trying to show you that the different parts of the brain control different functions within our body. And based on where the brain dies without blood, the presentation will vary. So for example, if you develop a stroke here, then your presentation will be weakness in this part of the arm, okay? If you develop a stroke in this area, your first presentation will be blindness, okay? If we follow this and you have a stroke in this area, then your first presentation will be weakness in your legs, okay? And that's why we have these differential presentations as far as strokes are concerned. Now, why do you need to know about strokes? What is it about strokes that makes it such an important topic that we have to discuss about it today? So there are 13.7 million new strokes each year. Every fourth person aged over 25 years will suffer a stroke in their lifestyle. So everyone who thought that strokes are only a condition of the elderly, they need to look around and see that anyone above the age of 25 has a 1 in 4 risk. So I can see we are about 50 participants right now, and 1 in 4 means at least 10 to 15 of us are at risk of getting a stroke, and that's a significant number. Now, what we don't know is stroke is the second leading cause of death worldwide. Yeah, 5.5 million people die of stroke annually. In third world countries, we are so focused on communicable diseases like malaria and TB that we often neglect conditions like stroke, and that leads to a higher rate of morbidity and mortality in our setup. Stroke is a leading cause of serious long-term disability, and every year, over 116 million years of healthy life is lost due to stroke. And this is significant. So if you lose your ability to write, and you were someone who was a writer, then that's literally a change in your entire livelihood. If you were a soccer player and you lose your ability to lose your limbs, then you really have to now start thinking about a new career path, because you're no longer able to continue with your life, as it were. Now, of the strokes, ischemic strokes are the commonest. 88% are ischemic and 12% are hemorrhagic. 9.5 million new cases of ischemic strokes occur worldwide. And strokes can happen at any age. So nearly 60% of all strokes are in people who are less than 70 years of age. Yeah. And even 7% occur in people under the age of 44 years. 52% of new ischemic strokes occur in men and 48% in women. And 2.7 million people die from ischemic strokes. Does this come as a surprise to the people in the audience, or is this something we knew about it? Is it surprising?
Yes, it's quite surprising.
So types of stroke. So I've been talking about ischemic and hemorrhagic. Now, an ischemic stroke are caused by, blockage in one or more of the blood vessels that supply a part of the brain. Think about like how sometimes our sinks get clogged, like there's something that just fills the blood vessel, and now the blood can no longer flow. And majority, over 80% of the strokes are actually ischemic. And then we have hemorrhagic strokes. So hemorrhagic strokes occur when the blood vessel bursts, like when a pipe bursts and all the water in the pipe leaks out. And this is now attributed to about 10 to 15%. And then you have transient ischemic attacks. So transient ischemic attacks are considered a mini stroke. So you have signs and symptoms of a stroke, but those signs and symptoms get better within 24 hours. And when we do any form of imaging of your brain, we don't find any area that's dead, okay? Now, transient ischemic strokes are very, very important because it's a preliminary sign for a stroke in the future. Now, it doesn't mean that all strokes will first present with a transient ischemic attack. No, that's not true. But there are few people who present with a transient ischemic attack, and we have to be extra careful with these individuals because their risk of getting an ischemic stroke in the future is very, very high. So this is just to break it down. So if you look at the image this is the image on the left, this is the image on the right. So a hemorrhagic stroke is, if you look at this blood vessel, it has burst and there's bleeding within the brain tissue. Okay, so remember we talked about depending on where your blood supply is compromised, the presentation of stroke will differ. So if you have a bleed around here, the person may present with, depending on which area of the brain it is, may present it with weakness of the legs. If it's in another part, it may be weakness of speech, yeah? And if you look at ischemic stroke, so if you, this blood vessel, if you look at it keenly, it looks narrowed and it also looks blocked. And following this blockage, the entire area that is supplied by this blood vessel dies. Yeah. And this is what we call ischemic strokes. And these are the commonest symptoms. These are the commonest strokes that majority of the patients we see present with. Now, what are the risk factors? Some people may think stroke is just a part of witchcraft, and everyone has their reason. But scientifically speaking, there are many risk factors for stroke. We've already talked about age. Older age is a risk factor for stroke. But there are other things like smoking. Now, smoking has been shown to cause lasting injury to your blood vessels, to your brain, to the vital organs within the body, whether it's the kidney, whether it's the heart. And what smoking does is that the chemicals released from smoke, what they do is that they cause damage to the blood vessels that causes narrowing, okay? And they also make blood thick, which makes it easier for the blood vessel to get blocked, okay? The next thing is obesity. So when people are obese, what tends to happen is their risk of diabetes goes up, their risk of high blood pressure goes up, and now we are seeing more and more chemicals that are released from fat cells that cause similar damage to the blood vessels, like smoking, like high blood pressure, like diabetes, that in the long run increase your risk of getting a stroke. Next is medications. So there's certain medications that increase the thickness of the blood, okay? Whether this is certain forms of contraceptives, whether it's certain forms of medications, and there are different kinds of medications that increase your risk of getting strokes. But medications are thought to be more important also with hemorrhagic strokes, because if you're taking certain blood thinner medications, then they increase your risk of bleed within the brain, okay? And they can be now a risk factor more so for a hemorrhagic stroke, but depending on the medication, it can also increase your risk of ischemic heart disease. Then heart disease. Now, the heart is a very, very important organ, okay? Now, when people suffer from conditions where the heart rhythm, the heart is supposed to beat in a systematic manner, but sometimes it can beat irregularly, or it pumps in a very slow manner, if I'm to put it simply, that clots start to form within the heart. In both these cases, what can happen is the clots that are forming within the heart can actually dislodge, can break off, and can travel all the way to the blood vessel within the brain and block it, causing a stroke. All right. Now, physical inactivity is linked to obesity, and for that reason, it's considered one of the risk factors for stroke. Stress. Now, we're all leading very stressful lives. A majority of the people, me included, we're usually very stressed. We have something or the other to worry about. Now, stress is also thought to, what stress does is that it keeps your body in a heightened state, okay? Your adrenaline is always pumping. There's certain hormones like cortisol that's also pumping. And all these hormones are thought to also lead to conditions like diabetes, like high blood pressure. And also there's certain chemicals that are released, again, that can cause narrowing of blood vessels and cause blockage, leading to strokes, okay? Now, sometimes when we are very stressed, our blood pressure may go up suddenly and a vessel may burst, okay? Within the brain, and sometimes it can also take place in the heart, leading to now a hemorrhagic stroke. Now, alcohol. So all of you who are listening in with a glass of wine, it's important for you to know that alcohol has been shown to have beneficial effect when it is consumed in moderation, okay? But when we start consuming alcohol in large quantities, so I mean, a glass of wine a day is okay, a single or a double tot of whiskey is okay, but then when we go to consuming 4 to 5 glasses of wine every day, we're drinking crates and crates of beer, not only does it lead to obesity, it also increases your risk of diabetes. The other thing is high blood pressure. Now, high blood pressure, and by this I mean any pressure above 120 or 130 systolic over 80 to 90 diastolic, what it does is that it over time changes the structure of your blood vessels such that they keep becoming narrower and narrower as the time goes by. And for that reason, not only can you get ischemic strokes, but you can also get hemorrhagic strokes. So you can either get a block or a bleed as a result of this. And then diabetes. I know you'll have another session as far as diabetes is concerned, but diabetes is one of the most important risk factors as far as end organ involvement. By that, I mean as far as strokes are concerned, as far as heart attacks are concerned, as far as eye disease is concerned, and as far as renal failure is concerned. So it's very important for us to identify patients with diabetes early so that we can maintain their blood sugars at the optimal range so that we prevent them from developing strokes, heart attacks, kidney disease in the future. And then there's high blood cholesterol. Now, what high blood cholesterol does is that it goes and sticks within your blood vessels, making it narrower and narrower, okay? It's very sticky, but we have to be careful about what cholesterol we're referring to here. So there's good cholesterol and there's bad cholesterol. So bad cholesterol are things like LDL. If anyone's heard about it, or if you've had your cholesterol checked, I'm sure you have many numbers there. So LDL is the bad cholesterol. It's the one that goes and sticks everywhere. It's the one that causes damage in multiple organs. But the contrary to that is something called HDL cholesterol, which is a high density cholesterol. So high density cholesterol is like a cleaner. So it goes and sweeps your blood vessels so that it gets rid of all the cholesterol that's sticking within your blood vessels. Okay. So these are the risk factors. There are other risk factors, but these are considered common. We've already discussed age as well. Anyone above the age of 40 has a very high risk of getting strokes, and 7% of strokes are in patients less than 25 years of age. Now, how does a stroke present? So as I've mentioned, it all depends on the part of the brain where the blood supply has been compromised. So this is the mnemonic I'd like you all to remember, and it's called Be Fast. Initially, we used to just call it FAST, but now we've included Be Fast. So the first presentation of strokes. Now, what's important for us to know is strokes will usually present suddenly, okay? Because all control of the brain, all control of the body comes from the brain, okay? It's the pilot. So if your pilot has a heart attack, then one by one, everything is gonna start failing, all right? So some people may present with loss of balance or dizziness, okay? And sudden onset headaches that are different from your usual headaches are usually a red flag as well, okay? And there's a certain kind of hemorrhagic stroke called a subarachnoid hemorrhage that presents with a sudden onset thunderclap headache, okay? So if you know someone, or if you're someone who develops a sudden onset headache, sudden onset dizziness as well, or sudden onset loss of balance. So by loss of balance, I mean you're someone who was walking normally and then you start walking like a drunk person, yeah? Then you need to go to the hospital and get checked. Eyes as well. So eyes, if the part of the brain that controls your vision gets a stroke, then you can either present with sudden onset blurring vision, but you can also present with blindness, okay? So if you get sudden onset blindness, then that's one of the things that should alarm you to head to the hospital. Now, these other ones that I am going to talk about, they're slightly commoner. So facial drooping, and with facial drooping, you know, the face appears a bit abnormal. You also notice that the speech has started to slur a bit. They're not as fluent as they used to be. Arms. Now, you can get sudden onset weakness of your arms or your legs, okay? Now, you can have weakness only of the arm. You can have weakness of only the legs as well. You can actually, one of the other presentations of stroke involving the limbs can be, you can use your arms, but you really can't feel them, like they feel very numb. And this has started off very suddenly. This should also alarm you that you could be having a stroke. And then I've talked about speech difficulty. So in essence, with and I'll talk about this further. The reason why this mnemonic is so important, and the reason why it's so important for us to talk about stroke, is because time is brain. The longer you take to present to a hospital from the time you have a stroke, the more area of the brain, there's more area of the brain that will die off. Okay, and that's why the sooner you can present to the hospital, the earlier we can either give you medication to try and treat the stroke, or we can at least try and arrest the ongoing process. And this is why time is so important. Okay, so if there's anything I want everyone to take away from here, is how to recognize a stroke. Okay, and you know, strokes can happen anywhere. They can happen at home, they can happen while you're heading to work, they can happen while you're at church. So it's very important that we bear this in mind so that we present to hospital in time, and we can try and save as much brain from dying off as possible. Okay. Now, treatment. So what I want us to get from here is, anytime you have symptoms of a stroke, the first thing for you to do is to head to the hospital. Okay. Now, if you present within 4.5 hours, all right, to the hospital from the time of your symptom onset, we will first do a scan of your brain. Once we have confirmed that you're not having a bleed in your brain, there is an option to give you medications that can burst the clots, okay, that is causing the stroke in the first place. All right. The clot bursting medication has its own risks, okay, but we're able to gauge those risks on a patient-to-patient basis. So what I want everyone to take away from here, in addition to knowing how to recognize a stroke, is to present to the hospital as early as possible. Okay. Now, if you present after 4.5 hours, all is not lost. Okay. Within the first 24 hours, there is a therapy that has been approved called thrombectomy. And thrombectomy means we go in, we get to your blood vessel, and we try and suck out the clot. Okay. What this does is, the area of the brain that has already died, we will, that area will take time to heal, but we prevent it from expanding further. Okay. So within the first 4.5 hours, there is a chance that we can give you medication, but we have to look at certain characteristics. We have to make sure you're not at very high risk of bleeding. Within the first 4.5 hours, we're able to give you that clot busting therapy. Within the first 24 hours, the option is to do something called mechanical thrombectomy, which means we go in and we try and suck out the clot. But if for whatever reason we're not able to suck out your clot, we're not able to give you clot busting therapy, or if you presented too late, our objective then is to prevent you from getting another stroke. All right. And we do that by initiating medications like aspirin. So you all may have heard, or if you have nursed someone with a stroke, you may have heard of Ascad or aspirin or junior aspirin. And that's what we maintain patients on for the rest of their life. And this is because once you get a stroke, once you get a TIA, your risk of getting another stroke is quite high. All right. And then what's key in the recovery of patients with stroke is rehabilitation. And then, whenever you're admitted with a stroke, we do a very extensive workup, okay? So not only do you get a brain scan, we also check your neck vessels that supply your brain to see if there could be a clot there that may have, broken off and caused the stroke, because the therapy for that is a bit different. We also keenly look at your heart to make sure that there are no heart abnormalities or there's no clot in the heart that may have traveled to the brain. We check your cholesterol level. We check you for diabetes as well. And when you're younger, whenever you're less than 50 years of age, we also screen you for other conditions. Some people have a genetic predisposition to strokes. Some people have increasing higher risk factors for coagulopathy, which basically means that their blood is very sticky and hence you can get blockages. So a lot of the times whenever we get a stroke in the young, we do a very extensive workup in these individuals, okay? Now, what's key to recovery from stroke? So unlike any other part of your body, your brain takes a much longer time to recover because your brain cells take time to heal and to recover. And that's why once someone has had a stroke, their ability to regain function, whether it's ability to walk, whether it's ability to speak, whether it's ability to write, takes from weeks to months, okay? Because essentially what we're trying to do is we're trying to retrain the brain, okay, to be able to do all those functions that it was once able to do. All right, so this is a very integral part of stroke management. So physiotherapy is very important. Occupational therapy is very important. We have to retrain individuals to get their power back, to get that ability to speak, to write, to dance, all of that back, okay? But it takes a very long time for that to happen. Now, how can I prevent a stroke? And I personally believe this is where the money is. I think the way forward is actually prevention. We need to, because everything that I've talked about is actually preventable. And even if you're diagnosed with diabetes or high blood pressure, the whole idea is the better you control these conditions, the lower your risk of getting strokes in the coming future. So this is how we prevent, and I think this is a slide I'll spend the most amount of time in because I feel like this is extremely important for us to understand. It's important for us to understand that strokes are preventable. We can reduce our risk of developing strokes and disability that follows thereafter. The millions of people that have died from strokes can be prevented, okay? So the first thing is keep your blood pressure low. And by blood pressure low, we don't mean drop it to less than 90. We're just saying control your blood pressure and maintain it at a range of 120/80, okay? But by this, I don't mean if you're someone who walks in, who's just had a jog, and you check your blood pressure, it will be high. But I don't want you to freak out if you see that. The trick is you need to be completely relaxed when you're taking your blood pressure. You need to make sure the arm that you're using to take your blood pressure is resting on a table. You should not have tea, coffee, or any form of stimulant at least 30 minutes before you check your blood pressure. If you notice a high reading, please don't freak out. A lot of us get stressed and that drives our blood pressure. Just repeat it again after a few hours, okay? And if you've checked it at multiple times and it's still high, the best thing to do is to go to your healthcare provider. And at this point, you can come to Avenue and we can guide you on how to manage your blood pressure, okay? Lower your cholesterol. Now, there's been a surge and there's been this change in our lifestyle. We are indulging in a lot of KFC, we're indulging in a lot of fried food. A lot of us are spending a lot of time on computers and we are not having much physical activity. So all the cholesterol within our body is not being utilized. And because there is so much cholesterol that's freely circulating in your system, it's going and it's just sticking into your blood vessels, all right, increasing your risk of not only stroke, but even heart attacks. Eat healthy food. Now, what's healthy food? I mean, what may be healthy for you may not be healthy for me. So by healthy food, what we mean is you need to have a balanced diet, and everyone seems to have a different understanding of what a balanced diet is. Now, if this is your plate, okay, you should always aim to divide it into a third, okay? So 3 1/3, all right? 1/3 of it should be vegetables, okay? You should have protein, which is a third, all right? And then a third should be carbohydrates. Now, the mistake we make in a lot of the diets that we follow is more than 50% of our plate is actually carbohydrates. So whether that's ugali, whether that's chapati, whether that's whether that's mokimo, whether it's sweet potato or potatoes, a lot of the times that's what's more than 50% of our plate, all right? And then we'll maybe, if it's ugali, we'll take 25% of sukuma wiki with it and we'll call it a balanced diet. But we have to make a conscious effort to understand what a healthy lifestyle and healthy eating is. And there are small changes that you can make to your diet. So for example, it is preferred that you should have um, in your breakfast should be your heaviest meal of the day. Okay, you should try and have a snack maybe at 10 a.m. It could be a fruit, it could be a few nuts as well. Then you can have your lunch, and you have many options. You can have, if you're someone who eats meat, you have options for fish. It's preferable for you to include white meat over fried meat. So over red meat like nyama choma is not preferable as well, because it also increases your risk of gout in the future. And then you can have another snack maybe at 4 o'clock or 5 o'clock, and try and have your last meal by 7 or 8 p.m. Okay, and your meal at night should be your lightest meal. And the reason is because majority of us go to sleep after that, so all that we're eating is not utilized, and it just goes and gets stored in our fat cells, and we end up gaining weight. Okay. Exercise regularly. Now, what does exercise mean? What does regularly mean? Just today, a patient was telling me, Doc, I exercise, I just skip for 5 minutes on one spot, and that's it. I don't think it's safe for me to do more than 5 minutes. And he said, and I asked him, why do you think so? And he said, no, it's just what I think is right for me. For exercise to be useful, what we advise is that you should exercise for at least 30 to 40 minutes a day, for at least 4 to 5 times a week. And the exercise can range from jogging to swimming to brisk walking. I'm not saying skipping is prohibited. You should skip if that's what you prefer as your form of exercise. Zumba, there's yoga. There's so many options. I've recently seen a spin class has opened up in Westlands, and that's also good. For the elderly population, I do advise that start slowly and build up. Start with maybe just a walk a day, start with 500 meters, then go to a kilometer, and then slowly increase your exercise tolerability and capacity. What we want from your exercise schedules is for you to be, your heart to be racing, for you to be sweating profusely, okay? And that will not only reduce your risk of diabetes, high blood pressure, and stroke, it will also reduce your stress levels. It will also help you sleep well at night, and it will also reduce your risk of depression. It will improve your mood, and it will also help you work better in your place of work. So it has a lot of advantages. Treat sleep apnea. So sleep apnea is, I don't know how many of you have partners who snore at night. Yeah, I'm sure some of you have, are looking at your partner and blaming them because you didn't sleep well last night because they were snoring so loudly that you woke up thinking someone had, there was a dragon in the house. So sleep apnea, what happens is that um, a lot of the times when we have some form of blockage in our airway that takes oxygen in, or we are very obese, all right, such that it's affecting our airway, it really puts a strain on the heart. Okay, and there are many mechanisms for why that happens, and sleep apnea has been noted to increase the risk of high blood pressure in individuals. It has also noticed, and we've also noticed it increases the risk of diabetes. Okay, the next thing is diabetes. Now, diabetes is going to be the next pandemic. We are getting more and more individuals who are pre-diabetic and diabetic, and they're presenting at very young ages. And the trick to prevention is we need to be screening you regularly for diabetes and for high blood pressure. And once you've been diagnosed with diabetes, our target is to maintain your sugar levels at a certain target, okay? And what that does is that it then reduces your risk of developing strokes in the future. And all of these things complement one another. So healthy diet also reduces your risk of diabetes, and so does exercise, okay? As I mentioned, drinking in moderation. Um, Smoking is one of the activities in the world that has no beneficial effect. I mean, there've been studies done over and over again, but it just has deleterious effects on the body, and there's not a single organ within the body that is not affected by smoking. So if you're someone who smokes, I would highly suggest that you stop. And if you need help stopping, we're here for you, and we're here to assist you to do so. And then there's stress. Now, managing stress needs active participation. It needs active involvement. It needs us to make very conscious decisions about how we're going to manage stress, because if we don't, then we're gonna present with strokes and heart attacks. Stress also increases your risk of diabetes and high blood pressure and obesity. Stress also makes people indulge in intoxicants like drinking excessively, smoking, or getting into drugs. So we need to make an active effort to avoid stress. There are many things that have been shown to reduce stress. There are activities like yoga, there are activities like nature walks. Counseling is also something that helps. And I'm sure even as a church, you have, an opportunity to talk to someone about your problems. So as much as possible, try and work around the stress that you have. I know that it's impossible to lead a stress-free life, but we have to make a conscious effort. And then maintain a healthy weight. So your weight is dependent on your height, and what you're supposed to be calculating is the BMI, the body mass index. Okay. So now that we're talking about prevention, these are a few of the packages. If they appeal to any of you, I think we need to work towards screening. We need to screen you at a younger age. If we find something, then we want to help you manage whatever condition it is that we find you have. Okay, so they're different packages. The packages differ because as you age, we also start thinking about other conditions. As like for women, we're actively thinking about breast cancer. We're also thinking about cervical cancer. Not that it's linked to stroke in any way, but it's when we're thinking about packages, we're thinking of it in a more holistic manner. If you have any questions, you can call on this number. Okay, thank you for listening, and I am open to questions. I hope that was clear, but I'm happy to make any clarifications that you may all have. Thank you very much.
Thank you. Thank you so much, Dr. Karishma. I've learned so much, and the people who've already typed in questions, everyone, I'd highly encourage all of us to put in any questions that you have, and within the time that we have, Dr. Karishma will be able to answer. So the first question here comes from somebody who says her name is Karegi Gitari. So she's asking, let me just go to the question. Yes. What causes stroke in children? Currently, her daughter, who's 8 years old, is battling her second episode of stroke.
Okay. Thank you. Thank you. That's a great question. Strokes in children are thought to occur from, I'm not a pediatrician myself, but strokes in children usually have a genetic predisposition to them. So there may be certain genes within the family that are increasing her risk of getting strokes. Yeah.
Okay. We have another question here from Sheila. Sheila asks, on prevention, please talk about the how, and she writes this in caps, how to keep your blood pressure low. Like how, again, she asks in capital letters, how?
Okay, Sheila, that's a great question. So, you know, the idea is to maintain your blood pressure. So when we're born, as we go through our youth, we have a certain blood pressure. And when we follow a good diet and a good lifestyle, we have our cholesterol in check, that those habits in themselves actually lower your blood pressure by at least 4 to 5 millimeters. Okay. Avoiding things like smoking that increases the stiffness of your blood vessels also also reduces your risk of getting high blood pressure in the future. If you're someone who's been diagnosed with high blood pressure or hypertension, all of these also have a role to play in lowering your blood pressure. So aerobic exercises, having a controlled diet, avoiding smoking, and drinking in moderation. So you know, when we're talking about high blood pressure, the objective is not to lower it to 90s or 60s or 100. If you're someone who has a blood pressure between, say, 110 over 120, 125 over 75, 80, the target for you would now to maintain your blood pressure at that range. Okay. If you're someone whose blood pressures are constantly elevated, now based on your age, we'll perform certain investigations. We will still encourage you to, you know, maintain a good and healthy lifestyle, control your diet. But if all of those fail, then we'll have to initiate you on medication to try and help control your blood pressure. Thank you. I hope that answers your question.
Thank you. Sheila, you can comment if that answers your question. More people are just commending you for a wonderful presentation. I think it's important for us to highlight that. Somebody here says, thank you very much for great sharing. Kindly reshare the slide that has the package you have for men. Somebody has requested, his name is Martin, you kindly reshare the slide that the package that you have for men. Thank you. As we proceed again, people just commending you for the great presentation, but there's a question here from Esther. So she's asking, how long does it take for a stroke to heal? Currently, she's recuperating from a stroke for about 3 months now.
Thank you, Sheila, for your question. And thank you for being open about your diagnosis. So there is no hard and fast rule. What we do know is that it will take a few weeks to a few months. Other factors are also your age. It also depends on the extent of the stroke, the location of the stroke. So there are many factors that contribute to the healing of the stroke. So it's not a one size fits all. As you may have noticed, and I'm hoping that following the diagnosis of your stroke, you've been seeing some form of improvement as the weeks have gone by, and the improvement will continue, but it will take a few more weeks and sometimes even years before you can get your complete function coming back. But yes, there are other factors. It would depend on where the location of your stroke is as well, what your age is like, what other risk factors you have that increase your risk of stroke, and whether you've been regularly taking your medications that are going to prevent you from having another stroke. Okay.
Thank you so much, Dr. Karishma. That was Esther. Esther, I hope you've had the response. I'm getting somebody else talking. I'm not sure who it is. So kindly, if there's anybody who's talking, kindly mute. Anyway, as we proceed, there's another question. Let me look at it. Yes, there's a question here that asks, how can people support stroke patients from home? Because I believe, Dr. Karishma, some of them end up, of course, going home since they can't be in hospital this whole time. So how can people support patients who have suffered from strokes at home?
Thank you. Again, that's a great question. And I'm feeling a lot of the audience have had firsthand experience managing people with stroke, and they understand that it's not easy. So Avenue actually have a home care package, which is a very comprehensive package. I'm sorry, I don't have the slide for that, but if you allow me, I'll be able to share it with the church after this. And basically it's, every stroke patient has different needs. Okay, some people will need physiotherapy, some people will need occupational therapy. Physiotherapy can be arranged. A physiotherapist can come home to help you. If you need a full-time nurse, that can also be arranged through Avenue Healthcare, who can be checking the blood sugars, who can be checking the blood pressures at home, can also feed. Some of these people lose their ability to swallow well as well. And the nurse can also help with cleaning up for these individuals. And we can also have a doctor coming home to see, in special circumstances, coming to see these patients. Sometimes we have very elderly patients who are not able to come for reviews in hospital. So we have a home care packet, and we encourage more and more people. The management will depend on, again, what the needs of the patient are. Some patients don't need to go home with a physiotherapist or a nurse, but some do. And those that do, we're able to arrange for that through Avenue Home Care. Thank you.
Okay.
I hope that answers your question.
Okay, thank you so much, Dr. Karishma. And just to add, some of you may not know, but I've actually firsthand had experience taking care of a stroke patient. More precisely, it's my mom. And one of the, aside from the medical part, which I know Dr. Karishma will speak from a medical point of view, there's also the emotional support that you need to provide to any patient who has suffered from stroke. As she said, it could happen differently for different people. Some lose their ability to speak, some lose their ability to move. So what you need to recognize is that this person, their lifestyle has shifted. Same case to yours. It has also shifted because now you have to also learn the basics of being maybe just a primary caregiver, even though it's just the basics. So just to highlight, it's important to know how to provide emotional support. And if you don't know how, that's why I know Dr. Karishma is saying they do have specialists, and I'm sure within Avenue Hospital, they may have even counselors and people who can take you through that process, because I believe it's not easy for anybody, seeing that one person is not able now to do what they were used to doing. So I'd like to also highlight that. As we continue, so many questions are coming in, Dr. Karishma, goodness, and it's a good thing. So there's a question here from Rose. She's saying, lately I have been experiencing numbness in my hands and legs and chest pain when bending. Is this related to stroke?
Thanks, Rose, for that. I think we'd have to get a bit more history to be able to determine whether it could be from a stroke or not. So I think that history is not very adequate. But if you are experiencing sudden onset weakness on any part of your body, I would suggest that you head to the hospital, and seek medical opinion in that case.
Okay, thank you. There's Dorothy here who thanks you for the presentation. She's learned a lot. There's another question here. What is the risk of what is the risk, if any, for low blood pressure?
Again, okay, so the risk of low blood pressure depends on how acutely somebody develops low blood pressure. There's some individuals who are able to maintain a low, who are able to go on with their day-to-day activities, and their blood pressures whenever they check is 90/60. My advice is, if you have low blood pressure, you're not experiencing any tiredness, you're not experiencing any dizziness, then that's probably what your body is used to. And I don't think you would need any further workup. However, if you're someone who's normally having higher blood pressure, whether it's 120/90 or 120/80, and then of late you've noticed that it's much lower, then I would suggest that you get checked up. Which is why it's so important that we get routine tests done on ourselves, so that we're able to identify what is normal for us as individuals. Josephine, if you'd allow me, I just want to make one comment on something that you said, which I think was great, about mental health of stroke patients. And I think it's very important that we take care of one another. I'm very, I applaud Parklands Baptist Church for this initiative. And I hope, within the church, there are support groups that can help families and patients that suffer from strokes, to help them get through this, difficult time, and it could just mean maybe just praying with them, or just reaching out to them and finding out if there's anything that they need. It could be financial, it could be emotional support. So I'd really encourage you all to form mini support groups that reach out to these patients and help them and their families get through this difficult time. Thank you.
Thank you so much, Dr. Karishma. As we continue, there's somebody here called Jane Onimbo who says the COVID pressure readers seem not correct. For example, mine is always 36, but when done in hospital, it's always lower. Is this good for the public?
Great question. Well, I'm not too sure what thermometers they've been using. As far as COVID is concerned, I think we're more worried if your temperatures are higher than lower. So I wouldn't worry about it. I'd be worried if you had the symptoms, the classic symptoms for COVID, which is fever, cough, difficulty in breathing. Irrespective, I encourage all of you to get vaccinated, so that we avoid getting you receiving you in the hospital much sicker. Okay, yeah, but I wouldn't worry too much about it. Everyone is using very different thermometers. There's no standardized thermometer that we're using, but I'd be more worried if the reading was high. But if it's low, I wouldn't worry about it.
Okay, thank you so much. We have a follow-up question from Karegi, who talked about her baby who suffered a stroke. So she's asking, thank you for the answer. What's the best management for the stroke? As at now, I'm reading it as it is here. As at now, we are told that the baby has severe stenosis of anterior cerebral artery, posterior cerebral artery, and also medial area is affected. What is the best management for this?
Okay. So I'm not a pediatrician, but my advice would be that she be seen by a pediatrician. Now, depending on the images, again, this is not my field of expertise, but I think the best thing is that she's seen by either a pediatric neurologist, which is a pediatric doctor who's now specialized in neurology, just to see if there's any way. You see, stenosis is basically narrowing, if there's any way to open the artery up or not. But I'm not the best placed to give an answer to that. Yeah.
Okay, thank you. So Sheila, who had asked about the how how to maintain blood pressure, since she's satisfied with the answer. A question here from Josephine Mwangi: are there other reasons for numbness in your limbs and even dizziness?
Great question. Absolutely. So there are many, many reasons why you can get numbness. Sometimes it can be certain nutritional deficiencies like B12 or folate, especially if you're vegetarian. There's certain infections like HIV or VDRL. Diabetes can also cause numbness because it affects the nerves of your hands. Sometimes if you just sleep poorly and you put a lot of pressure on the nerve supplying your arm, you can actually get numbness. Occasionally, sometimes the disc from the spine, when it's protruding and blocking the nerve, all that can cause numbness. That's one. Number two is about dizziness. Yeah, there are many causes of dizziness. Majority of them stem from the ear. Whenever you have an ear infection or whether you have anything that's affecting your inner ear can cause dizziness. People that age, we notice that as their inner ear organs age, they also develop dizziness. So there are many causes, and I don't think everyone should, if you have numbness, should start getting scans and, nerve conduction studies. It all depends on the kind of history we get from you when we see you in clinic, and then based on that, we're able to decide what is the best investigation to do. But what we need to be careful about is if it is sudden onset, numbness, weakness, sudden onset dizziness, then it's best that you head to the hospital and we check you up. That's the tricky bit. But if it's something gradual, then it's unlikely to be a stroke. Thank you. I hope that answers your question.
Josephine, you can comment to let us know if that answers your question. So there's another question here from I think Alfred. You had said that a stroke can happen to anyone, and also say that a predisposition in the family might cause a person to have a sudden stroke. So my question is this: are there telltale signs to show that you are at risk of a stroke if a family member has stroke?
Thank you again for that question. Great question. So if you're someone who has a family history of a stroke, the best advice I can give you is that you need regular checkup to try and control the risk factors for stroke. The only telltale sign that you can have is if you get a TIA, which is a transient ischemic attack, where you get a mini stroke. That is the only way we can predict whether, because it just tells us that you're at high risk of getting stroke. So my advice to you would be, if you're someone whose relative or loved one has had a stroke, the best thing is that you get whether it's high blood pressure, whether it's your diabetes, checked regularly so that we reduce your risk of developing a stroke in the future. But there is no test that can predict whether you will get a stroke in the future or not.
Okay.
Thank you.
Thank you so much. Thank you. There's a question. Once someone has cholesterol in the body, is it possible to get rid of it completely? That's Felista asking.
So, it's not advisable that you, and by cholesterol, I'm assuming you're talking about the bad cholesterol. Cholesterol is useful in the body. It's used in multiple processes in the cells. So the idea is not to get rid of all the cholesterol. The idea is we need to keep the bad cholesterol in check, which is LDL, and we need to also keep the HDL, which is the good cholesterol, in check. Okay, so that is usually what the idea is. It can be controlled with diet and exercise, but if it is not controlled with diet and exercise for whatever reason, then there are medications that can assist us in doing so.
Okay.
Thank you.
Thank you. Another question here. Are there non-registered or otherwise stroke survivors group or association in Nairobi, Kenya? I ask because caregivers would want to seek support, especially when it's a first-time case they're dealing with.
Yes, there are support groups, and I'm happy to share the links with you all after this.
Okay, we'll appreciate that. So somebody called Honorable Harrison just says good presentation. Then there's a question he also asks, can one automatically know their pressure without going for checkup?
Thank you. That's a very interesting question. I don't know how you would know. How would you know that your pressure is high or low? I think you need a machine to be able to check the pressure for you to be able to determine whether it's high or low or normal. So I'm not too sure how that would be done.
Yeah. And Dr. Karishma, are there machines that people can have in their homes to constantly check their blood pressure? Or do you have to go to the hospital every time?
No, actually, it is actually advisable that even when you go to the hospital, you try and get us a few readings from your house, because what we are seeing more and more is something called white coat hypertension. So most people that we are seeing coming to the hospital, because they're so anxious and they think that we're going to give them some bad news, their pressure is always higher. So we do notice that pressures within hospitals are usually higher than baseline. So we do advise having blood pressure readings from home. And there are machines out there. What is preferred is the one where you put the cuff on the elbow. The ones that are for the wrist are usually not very accurate. So yes, there are blood pressure machines that are available in most pharmacies that you can use to be checking your blood pressures at home.
Okay. So Karegi, who had mentioned about her daughter or child, I don't make a mistake, just say her child, says, thank you so much. The session is so informative. Looking forward to participating more. And also Josephine says, thank you for the exposition on numbness and dizziness. And somebody called Winfred says, great presentation. Thank you. So I'm taking it. That was the last of the questions we had. I know you have one of your members who I'll give like just very few minutes, like 5 minutes, Christine, if I'm not mistaken, to just give, to provide any info she might want to give. I know she had shared something on the chat. So Christine, 5 minutes, anything you want to tell us, over to you.
Oh, thank you. Can you hear me?
Yes, we can hear you.
Oh, thank you so much. Thank you, everyone. Thank you, Dr. Karishma, for a great presentation and information that you've been able to give us on stroke and any unpredictable way of strokes. Now, mine will be just less than 5 minutes, just to mention what the doctor had already mentioned about our home care services, where if you have a case in probably with a relative or someone that you know, it might not necessarily be your person, like your close relative. It could be a friend, it could be a colleague, even at work, who is struggling to get some of the machines or some of the items that can aid in helping people with most of the underlying conditions, including diabetes. And from my experience, I know diabetes is one that can be also a problem like a stroke. I had a dad who had it for years, and unfortunately he rested. But we had to buy a number of items like wheelchairs and other things. So Avenue Home Care, we provide those items. And you can come over to you can call any of the numbers with the flyer that I shared. And we will be sharing more of those brochures on Sunday. We have a medical camp happening on Sunday. Please kindly avail yourself. If you're in this forum, go tell a friend to tell a friend. Go tell a friend to tell a friend. Come for the screening. We'll be screening all of you for hypertension, diabetes, and such. So we will avail more information on Sunday through the brochures that you can carry home and share with other people in the estates, at homes, in the residential areas and all that. We want to ensure that people are in control of their health. So we want to reduce the number of hospital visitations and all that. However, we know we can't completely eradicate, but we can give more information even for those people who do not have that information. Secondly, I would also want to mention for these packages, we also be sharing the same brochures on Sunday. Please, I have been able to share as much as I can with the care center team. I know they have most of them, but since they cannot be able to reach out to everyone on their WhatsApp or myself, kindly ensure that on Sunday you are in for the service, you are in for the camp in the afternoon from 12 so that you can also get a number of them and carry home. So thank you very, very much, Josephine. It is such an honor to be in this platform. I think the greatest thing that any human being can do is to impact humanity. So Avenue Healthcare, we are here for you. If you have a very critical question or you need any information on any health issue, you've seen the doctors, you've interacted with them, at least you know them. So you will have a chance if you come to the hospital and ask for any information from our, you can call our lines, our hospital lines, and we will transfer you to the relevant department or to the relevant doctor who can be able to answer any of your questions. Or the best thing is to just come and visit, see the doctor, be able to have a one-on-one for any of the cases that you could be having. Thank you very much. I truly appreciate the church, Parklands Baptist. God bless you. Thank you for doing this. We truly appreciate for reaching out to a wider range of people who might not have probably have done this if it was not brought to them. Thank you so much.
Thank you so much, Christine, and even for keeping time. We've actually done in 4 minutes, which gives us at least 1 minute for Dr. Karishma to come back on, because somebody typed a question later, and this will be the last question we'll be taking because we are conscious of the time. Question is from somebody whose initials are BKK, and they say, I use Plavix 75 mg and Lipitor 80 mg. I'm assuming mg is milligrams because of stroke. The doctor told me that this is for life. Is that true? And are there negative effects?
Thank you for that question. I hope you can hear me. Yes, the medication is for life. Because what it's going to essentially do is reduce your risk of getting another stroke in the future. So aside from the Plavix, the other medication that you're on, gradually the dose will come down, but you have to continue it for the rest of your life. The drawbacks to it, not very common, but it can occasionally cause a bit of hyperacidity. The cholesterol lowering medication can cause a bit of fatigue and tiredness, but again, it's nothing that can't be managed because if you get another stroke and you've already had a stroke, then your risk of death is much higher. So when we look at the advantages of giving you the medications, they usually outweigh the minimal side effects that can occur from the medicines that you're on.
Oh, okay, thank you so much, Dr. Karishma. As we come to an end, there was a comment here from Martha Nyangao saying, thank you, Daktari, very well presented topic. And a final comment from Karegi Gitari, who says, thank you, Daktari, and the rest. She's an occupational therapist, and this is more of encouraging us, and she can assure all that therapy works. It has worked on her daughter and other clients she has attended to suffering from stroke. As at now, she's a full-time therapist to her daughter since August. For those who have been affected, just know that all is not lost. So it's mostly an encouragement. And BKK, who you just responded to about the medication, says thank you very much. So this brings me to, or us to, the end of this session. Thank you so much, Dr. Karishma, and also Christine for the elaboration. I've learned so much, and I being, as I had mentioned, having a mom who has suffered, from stroke, it brought so much light to many things that we see. And again, just to re-emphasize what Karegi has said, there's hope. Of course, it's a shift, but all hope is not lost. There's always a solution. We have people like Avenue. We have yourself in terms of keep your hope alive. Don't be discouraged. It's not the end of the world. So I'll take it now over to Pastor Edith to give us a closing prayer. Thank you, everybody.
Thank you very, very much, Jocelyn. And thank you very much, Dr. Karishma, for that wonderful, wonderful presentation. And thank you, Christine, also from Avenue, for just continuing to give us more details about what needs to be done. And thank you, Kate, for this organization, basically Care Center. Dr. Meshani may not be here, but I thank you all for organizing this. We continue to learn together tomorrow, and up to Saturday, and then on Sunday, the physical checkups, and we believe everyone will be there. And I want to thank God, as Josephine says, all is not lost. Let us always learn to live a day at a time. Even if we have been caught up or we are caught up, let us always trust God and let the joy of the Lord always be our strength. Jeremiah 8:10. So that even when we are caught up, we should know that the Lord watches over us and He takes care of us. But where we can be able to prevent, let us go out there. Let us not be just lazy or not do our part, so that we are also not we are not caught up by this. But thank you very much, everybody who has tuned in from whatever platform, and we thank God for you. Let us end with a word of prayer. Father, we want to thank you very much this evening for your goodness and mercy. We give you praise. We give you honor, Lord. We give you glory. Thank you for the wonderful presentation from Dr. Charisma that we have enjoyed this evening, dear Lord, and thank you for everyone that has been on this platform, Lord, even listening and understanding the lesson for today, Jehovah God. We want to pray that, Lord, you may keep the stroke at bay for us, and Lord, help us also as we have gotten so much knowledge, especially eating well, exercising, sleeping well, and doing all that which we need to do, so that, Lord Almighty, even as we take care, as we think of our lives, we can also be taking charge of our wealth, our health and wellness. And we pray that, Lord, you may keep us, Lord, in good health, because, Lord Almighty, at the end of it, you are the only one that takes care of each one of us, our God, and our lives belong care of our bodies, and so that we can live a longer life. We thank you and bless you the night. May you take care of us, our Father, and until tomorrow, honor and glory comes back to you. For this we pray with thanksgiving in Jesus' name. Amen and amen. And can you unmute and say the grace together? And now may the grace of our Lord Jesus Christ and the love of God and the fellowship of the Holy Spirit be with us now
and forever. Amen.
Amen. And a very good night.
Amen. Thank you.
God bless you.
Amen.
God bless you. Thank you.
Thank you so much.